An older adult client is brought to the clinic because of a nosebleed that won't stop. The client's daughter states, "My dad has had frequent nosebleeds before, but it always stopped after a few hours." On assessment, you notice pinpoint red spots on the client's legs and trunk that don't go away on pressure and bruises on their arms and legs. Based on these findings, a complete blood count, or CBC, is ordered to check their platelet count. Now, platelets, also called thrombocytes, are cell fragments created in the bone marrow from cells called megakaryocytes. Platelets are essential for beginning the process of coagulation. So, when a blood vessel is damaged, platelets stick to the inner surface of that blood vessel, aggregate together, and form a platelet plug to stop the bleeding. The lifespan of platelets is about 8 to 10 days. When they become old or damaged, they are removed by the spleen. Alright. The platelet count measures the number of platelets in the blood and is usually measured as part of a CBC. The normal range for platelet count is from 150,000 to 450,000 per microliter. Now, there are some conditions that can alter the platelet count. When the platelet level is too high, it is called thrombocytosis. Trauma, inflammation, or blood loss can cause reactive thrombocytosis, where the platelet count becomes temporarily elevated and then goes back to normal once the condition resolves. The platelet count can also temporarily increase after a splenectomy because the platelets are not removed as fast as they are created. In contrast, conditions that can cause a sustained increase in platelets include certain myeloproliferative neoplasms, which are malignancies that cause the bone marrow to make too many platelets. On the flip side, when the platelet level is too low, it is called thrombocytopenia. Now, sometimes the bone marrow doesn't make enough platelets, which can happen in conditions like aplastic anemia or with bone marrow depression from cytotoxic medications like chemotherapy medications. On the other hand, healthy platelets can be destroyed due to conditions like sepsis, autoimmune disorders like immune thrombocytopenia purpura, from a reaction to heparin, which is called heparin-induced thrombocytopenia, if platelets pool in an enlarged spleen, or even in clients with intravascular devices such as an intra-aortic balloon pump. Thrombocytopenia can also be the result of consumptive coagulopathies like disseminated intravascular coagulation, or DIC, where platelets are used faster than the body can make them. Lastly, thrombocytopenia can be idiopathic, meaning it occurs spontaneously and has no identified cause. This is referred to as idiopathic thrombocytopenic purpura. Now, a client's platelet count is measured when a client is diagnosed with a condition that can alter the platelet count, or if there are signs and symptoms of high or low platelets. So, when platelets are increased, they can clump together and cause clots, or thrombosis, which can occlude blood vessels. When this happens in an extremity, clinical manifestations include swelling and pain from ischemia. Or the clot can travel and cause a venous thromboembolism. When clots form in other parts of the body, they can cause a heart attack or stroke. On the other hand, if platelets are low, the body will have difficulty making clots. So, clinical manifestations include easy bruising, petechiae, frequent nosebleeds, gastrointestinal bleeding, or even a brain hemorrhage. Okay, let's look at the nursing implications for a client with an altered platelet count. Your priorities of care are to assist in restoring a normal platelet count and monitor for complications. Begin by collecting a sample by venipuncture using a lavender-topped tube. This tube contains the anticoagulant EDTA to help prevent clotting of the sample. After obtaining your sample, remember to gently invert the sample several times to ensure the EDTA mixes with the blood, but avoid shaking the tube, as this will cause hemolysis, or breaking apart of the red blood cells, which will alter the results. In some clients, EDTA causes platelet clumping, resulting in an erroneously low platelet count. For these clients, a light blue-topped tube, which contains sodium citrate instead of EDTA, is used to collect the sample. Keep in mind, a client with an altered platelet count may need additional pressure applied to the venipuncture site to help stop bleeding. Alright, If your client has an increased platelet count, take steps to decrease their risk of thrombosis by ensuring they are well hydrated and preventing venous stasis by encouraging activity. Monitor for signs and symptoms of thrombosis, such as acute pain or swelling, chest pain, or status. Then administer the prescribed medications, including platelet-lowering agents or anticoagulants. If your client's platelet count rises above 1 million per microliter, immediately notify the healthcare provider, as this is a critical level. Now, if your client has a decreased platelet count, initiate bleeding precautions and monitor for signs of bleeding. As prescribed, administer glucocorticoids, thrombopoietic growth factors, or platelet transfusions. Let the healthcare provider know immediately if the platelet count drops below 50,000 per microliter, as this is a critical level. Finally, for any client with an altered platelet count, be sure to check their history for factors that can interfere with these laboratory results. For instance, taking certain medications like oral contraceptives can increase the platelet count. On the other hand, a decreased platelet count can result from recent transfusions of packed red blood cells or IV fluids, or if they are taking medications like sulfonamide antibiotics. Alright, as a quick recap, the platelet count measures the number of platelets in the blood and is a part of the CBC. Platelets are cell fragments that are essential for beginning the process of coagulation by forming a platelet plug. The normal range for the platelet count is 150,000 to 450,000 per microliter. An elevated platelet count can be temporarily elevated due to trauma, inflammation, blood loss, or a splenectomy, while other causes include increased production due to a myeloproliferative disorder. A low platelet count can be due to decreased platelet production, increased destruction or consumption, or the cause can be unknown. The sample is obtained by venipuncture, collected in a lavender-topped or light blue-topped tube. Nursing implications include assisting to restore a normal platelet count and monitoring for complications.